The Step into Healthcare programme is an initiative developed by Greater Manchester Academic Health Science Network, the Business Growth Hub in Manchester and TRUSTECH. The Step into Healthcare programme was established based on our previous experience and companies' experience that it's been very, very hard to engage with the NHS. The objective of the programme is to expose companies with innovative products to the requirements of the NHS, and is to actually improve the patient outcome and the patient benefits that will arise from developing new products and services.
I'm here today because the Step into Health programme is going to help us fine-tune our pitch to the NHS and help us with our business planning so that we can establish some costing profiles for our app, which we hope to release to market later this year.
The first cohort of 12 companies have progressed through the Step into Healthcare programme over the last 3 to 4 months, and during that time those companies that have innovative products and services have been exposed to a number of key opinion leaders and specialists from inside and outside of the NHS.
So well, you can have a CE mark for a manufactured product, you can have it for complete quality management, you can have the notified body test and release every single batch of your product if you want.
The specialists have provided support and expertise around developing a business case, developing the value proposition, understanding the regulatory landscape that companies have to navigate, working with NICE, the National Institute for Clinical Health and Excellence, and also understanding the decision-making process inside the NHS.
It's really to help SMEs, and part of our role is to help SMEs because they're great partners for innovation.
We were very excited to join the Step into the Healthcare NHS program, but we didn't know what to expect. And I can say now that after 12 weeks being into the program, we have been overwhelmed with the progress that we have made, the help that we have received from the team, and the leads that we have generated. I mean, one being an opportunity to present in front of loads of head of procurements in the Northwest, and hence we couldn't be much happier.
So I think the programme's been really helpful. It's built up to the culmination, which is the pitch today, and all the sessions have been geared towards giving us the information of how to present to the procurement representatives from the NHS, and it's all sort of come together today, and I think hopefully it'll all be really useful for our business going forward.
The mission's aim really is to treat the wheeze effectively, try and keep the child out of hospital and get them to be effectively treated at home.
I think they all understood what I was trying to get across, and they asked relevant questions, and I could answer all the questions, which is always helpful.
The Step into Healthcare event today has been really, really important. I think one of the important things that procurement people need to do is support SMEs and how they get access to the NHS, how they get access to be able to demonstrate new products, new innovations that they want to bring to market. I think this is something that the healthcare economy needs to support, and it's really important for the development of the marketplace and for new innovations to be brought to fruition, really. I mean, in terms of the day, I think it's been really, really successful, an interesting day. I've spoken to some of my colleagues after, and they found it beneficial to understand actually the new things that are being brought to market and the opportunities that can first and foremost support patients in a much better way.